Hey, I'm excited for today. This is probably my favorite topic to teach on. Immune system, how it relates to women's health, hormone health. This is a topic that I feel like does not get nearly enough attention and is probably the largest conversation we should be having around chronic health issues. So we're going to dive into a lot of that today. This will probably take a couple of weeks in a row to get all the way through because there's a lot of stuff to share about immune function, chronic infection, types of chronic infections, and then what you can do or start doing about those infections. So today we're going to start talking about how the immune system is connected and how that can be part of your root cause answers. So you've probably heard me say that before, right? Root cause answers. Holistic healing in general is all about finding the reason why your body is doing something, right? So if you have couple of examples, high blood pressure, chronic fatigue, migraine headaches, if you have a thyroid problem, even if you have something like adrenal fatigue, those are still just symptoms, right? That is your body doing something. You still, just by knowing you have those things going on, you still don't know why, right? And finding that why answer is what a root cause is. So if you've never really understood what that means, finding your root cause means finding the reason, the true trigger that started that cascade in the first place. And that's what we're going to talk about today, especially when it comes to the immune system. So I have worked with thousands of women, and across the board, the number one reason that most women have hormone imbalance, adrenal fatigue, thyroid problems, autoimmune conditions, the number one reason I see hands down is some type of chronic infection. This is a big deal, and it's something that is so rarely tested for, or if it is tested, there's not a whole lot of help, or there isn't a medication, or there isn't a quick fix, so it goes untreated for so long, and that's why it causes these chronic issues. So if you know anything about my story, the root cause for me was an undiagnosed, untreated chronic Epstein-Barr infection that led to my adrenal fatigue, my thyroid imbalance, my hormones tanking. At 28 years old, my hormones were at menopausal level, and I couldn't figure out why. I had no idea. I was living a healthy lifestyle. I was eating great. I was taking good multivitamin. I was taking good nutrients. I was exercising. I was doing all the things that you think would make a person healthy, yet my hormones were tanked. My adrenals were a mess. My thyroid was off. I was in chronic pain. And it wasn't until I found out that I had this chronic underlying infection that my entire life changed, right? Being able to take care of the right thing at the right time. And for a lot of you out there, if you're struggling with chronic issues like that and you haven't investigated a chronic infection, holy cow, like you're missing the root cause. You're missing the big piece of your puzzle that could be contributing to all of the symptoms you have going on. So today I'm going to tell you a few of the common ones I see as far as infections go. And then I also want to talk about COVID as it relates to some of these other infections, because we're seeing in a lot of people that when we're getting introduced to COVID, which is a very, irritating type virus to your body, you're reactivating some of these other infections. So people who are having these really long, drawn out bouts with COVID or the post-COVID issues, or you're maybe a couple of months after infection and you're like, man, I still don't feel good. I'm exhausted. My muscles are weak. My stamina is not back yet. It actually is more likely that your infection has reactivated some of the things we're going to talk about today. So if you feel like you're really struggling post-COVID, I highly recommend you investigate these topics because that's more than likely what's going on, especially Epstein-Barr. So I'm going to start talking about Epstein-Barr because there's so much research. And I love when people are like, well, there's no research to back that up. Tons of research. So go on, the PubMed, go look at real actual journal articles. Don't just Google it. There is a ton of research that backs up that these chronic infections can lead to autoimmune disease, migraine headaches, MS, all these things, yet it's just not a conversation that's being had loud enough, which is what I want to make sure I'm doing, is bringing this conversation as loud as we possibly can so people realize they have options when it comes to healing. So let's start with the number one thing that I see. That's my passion because it was my story, and that's a chronic Epstein-Barr infection. So Epstein-Barr in its acute form, when you first get it, it does cause mono, but most people, let's say you have mono, feel crummy, whatever, you get over it. It's not the actual mono in the acute form that's the problem. The problem is this Epstein-Barr virus gets in your DNA and it can stay there dormant, and then it reactivates in times of stress, right? Who isn't a little bit stressed sometimes? In times of hormone fluctuation, like if you're having abnormal cycles, pregnancy and postpartum is huge to reactivate Epstein-Barr. That's exactly what happened to me after the birth of my first child. The hormone fluctuations and stress, postpartum, reactivated it with a vengeance. Menopause, perimenopause, those are all times for a woman that our hormones are fluctuating. If we have a massive amount of stress, so a big life event, a divorce, a job loss, changes in life circumstances, a big move, those are all things that can reactivate a virus. And then other immune system triggers, getting exposed to a different virus, getting another infection. So specifically COVID, right? If you're getting exposed to another virus, then you can very easily reactivate the Epstein virus. And that's where the big problems come in. Because no, you don't have acute mono. They're not checking for that, right? You're not coming with the same symptoms. It's not your throat that hurts. It's not your fatigue to that level. But it's everything else, right? You just don't feel good. It's hard to get out of bed. You have brain fog. You're having anxiety. You're having all these other types of symptoms that are correlated with a chronic infection and not the acute form. And Epstein-Barr is one of the most common reactivated infections, especially in women. And here's where the research gets so interesting, is they're showing that Epstein-Barr is the number one cause of Hashimoto's thyroiditis, which is the autoimmune version of your thyroid, your hypothyroid, that Epstein-Barr gets in the thyroid and can actually create that antibody response. So if you have Hashimoto's, if you have hypothyroid and they've never checked you for antibodies, this is the sequence that has to happen, right? If you get diagnosed with hypothyroid, you then should be checked to see if it's the autoimmune version. So you should be checking your thyroid antibodies. And if those are positive, the very next thing you should be checking is a chronic Epstein-Barr infection, because it's documented to be one of the main causes of antibodies in your thyroid. Yet, how many of you have had that checked, right? If you have a thyroid issue, have you checked any of those other things? The answer is almost always no, which is why you don't feel that much better, right? Your thyroid numbers might be normal. You could be on a thyroid medication, but you're still like, I don't know, my hair's still falling out. I still can't lose weight. I'm still tired, but my thyroid numbers look good. You're missing the root cause, right? Your thyroid levels being off is just the response that your body is having to a chronic infection. You've got to figure that piece out if you really want long-term sustainable healing. But that's what really bothers me about healthcare right now, is that we're stopping at piece one. Oh, you have hypothyroid? Here's a thyroid medication. Oh, you have anxiety? Here's an anti-anxiety. Oh, you have abnormal periods? Here's a birth control. Oh, you have too much bleeding? Let's do a hysterectomy or an ablation. But nobody is diving deep enough to figure out why your body was doing that. So even after a medication or a procedure or a surgery, you still have the cause, right? You still have the infection or the overgrowth or the inflammation. So it's going to show up in other areas of your body, which is why we have so much chronic health junk, because we never dive deep enough to find the root cause. So for me, one of the number one things that I check on women, specifically women, this could be men too, but for women, hormonally, Epstein-Barr just creates a major storm in the body. So checking not only if you've had it in the past, but if you have the titers to show that it's still building in the body and that it could be reactivated. You've got to check multiple values. So make sure if you're getting this checked, you're doing it through someone who knows what they're looking for, because you've got to check more than just one Epstein-Barr value. That's really important. And I will actually do another video showing you the different markers. That could take a whole video in itself. So we'll go through more Epstein-Barr stuff specifically next week. But today I just want to teach you the common triggers, immune triggers. So Epstein-Barr is number one. If you have not, and even just kind of look up symptoms of a chronic Epstein-Barr infection, and if you're struggling with multiple of those, it's not unlikely that that is one of your root cause issues. And once you know that, then you can start choosing the right way to support your body. Because let's again go back to the thyroid. how you support a thyroid that's imbalanced because of, an actual deficiency versus an adrenal issue versus a viral issue looks very different, right? There's not one answer for everybody. You have to know for yourself what the root cause is. So Epstein-Barr is a huge one. And now we're showing with COVID that COVID is really reactivating people's chronic Epstein-Barr. So you have COVID and you feel horrible, right, for that amount of time. And then you start coming through it. And then a month or two later, you're like, man, I still don't feel like I'm recovering. Those are signs of reactivating those chronic infections. So if that's you, shoot me a message, comment. That's a big deal. This is something you want to make sure you get a hold of, because a long-term chronic Epstein-Barr infection that's reactivating can cause autoimmune issues, can cause those thyroid issues, can cause hormone imbalance, and is one of the things that will just make adrenal fatigue go so much faster, because it's exhausting for your body to have to deal with that every single day. So I love working with women who have chronic Epstein-Barr infections, because when you figure that out and you manage it properly, holy cow, really cool things happen, right? You feel like this big weight lifts off you. You feel like your body can finally heal again, because we really uncovered the thing that was blocking you from healing. That's so huge. So making sure that we're dealing with or checking for, first of all, if you have a chronic Epstein-Barr infection, and then making sure that that's properly managed so that it's removed from the body. And there's lots of different ways that you could do that. There's tons of natural agents, homeopathics. One of the ones that I can suggest that's generally safe for everybody, that has a great antiviral property, is called Monolaurin. It is antiviral, it's antifungal, it's very safe, and you can even get on Amazon. There's a brand called Lauricidin that you can take. So if you're just curious about your Epstein-Barr, you've had mono in the past, but you don't know your titers, but you'd like to start with something that can help support a chronic viral infection or a viral load, Lauricidin or Monolaurin is generally safe for everybody. And then once you know your titers, how your body's adapted to that infection, what else is going on, then you will need much more specific protocols to help really heal and come out on the other side of that. But a great starting place is that Monolaurin, that Lauricidin, and then making sure that your vitamin D levels are good, right? You can start on anything that's going to support the immune system. I love elderberry. That's a really easy one to find. So vitamin D, elderberry, Monolaurin, you can start those things just for general immune system support. And then you really want to get proper testing so that you could get individual protocols for that as well. So number one, chronic Epstein-Barr infection. For me, that's probably the biggest one. Honestly, the most important, and the one that is so rarely checked and left so long that it's the one that's causing the most major flare-ups and hormone imbalance and thyroid issues and those types of things. So if you haven't checked that, start there. For sure, that needs to get checked. Number two, chronic fungal or bacterial overgrowth and infections in the gut. These are also really common. Our modern day society, right? The inflammation, the poor food, the destruction of the microbiome has just created an environment in the body where it's really easy for these bacteria and these funguses to grow. Things like yeast and candida, things like strep bacteria, things like staph bacteria, Klebsiella bacteria. These are things that are actually being shown to be common overgrowth in the gut now, because we just don't have a strong enough microbiome to fight off these other bacterial and fungal overgrowths. Now, I want you to remember, if there's something overgrown in your gut, yes, it can create bloating, digestive issues, but that's not always the symptom, right? When I'll suggest somebody checks their gut for overgrowth, typically I'll hear them say, oh, but I don't have digestive issues. That's one teeny tiny piece of what that can create. You have to remember, if it's in your gut, so let's say there's a strep bacteria, a chronic overgrowth of strep bacteria in your gut. It's not just staying in your gut, right? It gets in your bloodstream and it goes to other areas of your body. So that strep bacteria can get in your liver, your adrenal glands, your thyroid, your muscle tissue, your nervous system tissue. And it's that chronic overgrowth that gets to those other areas that causes massive inflammation. Right? So if you have joint pain, if you have muscle pain, if you have brain fog, those are all really good signs that you probably have a chronic infection or overgrowth, because they're creating irritation widespread around the body. And they're just really common because our air we breathe, our food we eat, our water we drink, stress, medications, the overuse of antibiotics, those are the things that have created this epidemic of gut issues because our environment really allows that to happen. But those are things that you have to treat. If you have chronic overgrowth and infections in the gut is foundational to any other balance. So people will always want to skip the gut and go right to, oh, I want to fix my hormones or fix my thyroid. And yeah, that sounds fun. But if you don't have a well-functioning gut, digestive system, and a healthy microbiome, you can take all the supplements in the world and still not get the benefit for your hormones, your thyroid, your adrenals, because your microbiome and your gut really kind of is the master control of all of those other areas. So especially if you have digestive issues, right? If you have bloating, if you have gas, if you don't go to the bathroom on a regular basis, those are glaringly obvious signs that you have things going on in your gut. But even just the fatigue, the brain fog, the inflammation, are your rings tight? Do your joints hurt when you wake up? Those are also signs of chronic overgrowth and infection. And looking at the gut and the microbiome is incredibly important. And I will say, I've done videos about this in the past, the way to fix your microbiome is not just take a bunch of probiotics, right? I'm sorry to tell you, because everyone else is saying, hey, take my probiotic, it's wonderful and it will fix everything. That is just not the way it works. Because if you don't get rid of the bad stuff, if you don't get rid of the inflammation, if you don't close up the leaky gut, you can take the best probiotics in the world and they will do nothing because you didn't take care of the problem first, right? So be very careful about just taking things to try and fix a problem. You've got to find the cause, fix the cause, and then you can rebuild with the good stuff, but it has to be in that order. So if you haven't looked at your gut and your microbiome, number 2 is that. And then number 3 is parasites. And they're actually more common than most people would think. If there's a parasitic infection in your body, that also can get into different muscle tissue, cell, gut. That's a big deal also. Now, I would say Epstein-Barr, bacteria, and yeast are more common. Again, we run hundreds of stool samples and blood works, and like most of the time it's those two. Sometimes it is a parasite. And if it is a parasite, you need to know that because the treatment for a parasite is totally different. And again, to be the bearer of bad news, the way to fix a parasite is not a quick 2-week parasite cleanse, right? I know that's tempting. You can buy it online. It's really easy. It's 2 weeks and they're claiming my parasites will be gone. No, it doesn't work that way. Parasites live in a life cycle. Even if you kill them off in the digestive tract for 2 weeks, guess what? There's going to be eggs and there's going to be other life stages of those parasites that are going to keep coming back. So you might get it out of the gut short term, but if you don't do the right steps at the right time and make sure you fully eradicate them from the body, they will continue to come back and they will come back with a vengeance. So do not try and quick fix this. You don't go and buy the quick cleanse, the parasite cleanse, the kit that comes with the things that promise they're going to fix your gut in 14 days. If it was that easy, everyone would do it and everyone would be well. Yet we're not, right? Because it's just not that easy. And it is all about going in the right order. So this is very important for you to understand, especially when it comes to your immune system. There is a hierarchy of how these things have got to be handled. If you try and jump from just, oh, I have all these infections, so I want to do a detox, you're going to do major damage to your body. You have got to get rid, number 1, get rid of the bad guys and calm the inflammation. Then you have to support your adrenals, your hormone imbalance, your thyroid. You have to make sure your body is strong enough and able enough to go through a detox without crashing. So you don't move into the full flush out detox cleansing protocol until the infections are gone, until your inflammation is low, and until your adrenals and your hormones have some balance and some support, because then you can actually sustain going through a detox or a cleanse or those types of things. Yet everyone wants to start there, right? Because it's like the sexy fun thing. Oh, I'm doing a cleanse, I'm doing a detox. Nope, you probably shouldn't be if you haven't dealt with the other issues. That is one of the things that is so irritating also when you just see these general protocols and these things that people can follow. You can do a whole lot more harm than good if you're not doing the right things for your body. So I highly recommend that the first thing anybody starts with, truly no matter what your symptoms are, is checking the immune system, checking for infections, overgrowth, parasitic infections, either ruling those in or out, because if those are present, that is, regardless of hormones, regardless of adrenals, the first thing you have to support is your immune system and inflammation every single time. There is no time that answer is different. If there's an infection, an immune system issue, and inflammation, that is the starting place for your root cause answers. And it is probably the root cause for you. It's the missing piece of your puzzle if you haven't investigated those areas. So I highly encourage that you look deeply into Epstein-Barr, bacterial or fungal overgrowth, or if you do have some parasites, those are the things that have got to get dealt with. And just know all of those tend to exacerbate in times of stress, in times of hormone shifting, or when you've been exposed to other infections that irritate your immune system. Those other types of chronic infections and overgrowth tend to flare in those times. So if you notice that you have seasons that go up and down, like, oh, I felt really good for a little bit, oh, and then it just hit me again, and then I felt good for a couple more months, and then I had like 6 weeks that I couldn't pull it together. That up and down in symptoms is also really just kind of a red flag that that's an immune system chronic infection or overgrowth. So look back on those types of things. Do you have seasons in your life that you feel really drained, or that your body is just not responding the way that it's supposed to? The brain fog, inflammation, joint pain, headaches, those are all signs, things that I typically see when people have overgrowth and infections. If you have a really hard time losing weight, even if you're doing the right things, your body is putting on those extra layers to protect from overgrowth and infections. Those are all signs that this could potentially be your root cause answer. And I'm going to say it one more time. I've said it already, but I almost bet that somewhere in the immune system chronic infection realm is where your root cause answer is. So if you are struggling, if you have any imbalances that you feel like you're having a really hard time getting settled, getting fixed, and you haven't investigated Epstein-Barr, chronic bacterial and fungal infections, or parasites, start there. Seriously, start there, because if those are positive, those are your root cause answers. So I'm going to keep on this theme a little bit because there's so much to unpack. So next week I'm going to talk specifically about Epstein-Barr and where it comes from, how you get it, what it does in the body, and other tips that you can do to start supporting if you have a chronic viral load. And then we'll dive really deep into gut function, and we'll talk more about bacteria, yeast, and parasites, because these are a big deal. So let's take the next couple of weeks. I'm going to teach you guys all kinds of stuff you can start implementing into your life, nutrition changes you can make specifically to support immune system, gut, and microbiome. So thank you guys so much for watching. If you have questions, shoot me a message, put them in the comments. I would love to help you guys through just navigating some of this stuff. I know it's heavy, I know it's a lot, but I mean, I'm telling you, if you get a handle on this, it is life-changing. So have a great rest of your day, and we'll talk next week.